just to introduce myself, so I'm currently a clinical teaching fellow at Imperial. I work mainly at Charing Cross Hospital, teaching Gen Med and rheumatology. The level of training that we're both at, so we're both kind of in our F3 years, so we've taken that step out of training, but I'm going into IMT next year. I think that's everything to say.
Yeah. Hi guys as well. I'm Dan. I'm at the same level as Philippa, so also doing an F3. I'm working as a clinical research fellow at St George's. So part of my job is running quite a few research projects, clinical trials, other different studies as well. And we both have quite a lot of experience of different types of research projects as med students. So we're hoping in this talk we can pass on some tips that we've learned about setting up your own things, but also knowing what's a good project to jump on.
Yeah, we can't see anyone, so it might be quite difficult for us to take questions, but if we have some questions at the end, yeah, just remember your questions, and then we can discuss things at the end. So what we're going to cover today, so we're going to talk a little bit about why you should do research as a medical student, how to take an idea from a problem into a research project if you yourself have noticed something that you want to turn into a novel project. Tips on getting involved in other people's projects, which is definitely something where, particularly if you're in the earlier years of medical school, can be a good introduction into research. How to choose the right research project for you, and how to know which one is the best one for you to get involved with. And then we're going to briefly touch on kind of research versus audit versus quality improvement. Hopefully some of you will have had an introduction to some of those terms before, so we'll just touch on it briefly, but yeah, hopefully it'll be useful.
So I'm sure all of you, having come to this talk, you've all decided that you've got at least a baseline level of getting involved in research as a medical student, but I thought it'd be useful for us to talk about some of the different things you can get out of it, because it's not always obvious. You can see here we've got EBM, which stands for evidence-based medicine. It's the way we practice medicine, today, and being committed to evidence-based medicine and evidence-based practice means being committed to lifelong learning. Engaging in research projects will gear you up well for this, and it will help you with your critical thinking skills as well as your critical appraisal skills. In order to run or be part of your own research project, you need to be asking questions such as, is this research valid? Is this methodology valid? Are we looking at the right population, the right intervention, et cetera, et cetera? And those are questions as a clinician and as a practitioner going forward, you'll be asking yourself every single day. Engaging in research as well will build a whole raft of skills, not just obvious things like learning a bit about stats and data interpretation, but project management. How do we make sure that everyone knows what they're doing? All the participants in my trial, is everything clear? Do they have all the information they need? And as well as that, you will be working with a whole load of different people, from senior clinicians, academics, statisticians, research nurses, allied health professionals, other students such as yourselves. And you will undoubtedly be building teamwork and leadership skills there. It's also important for your career development, especially if you want to go forward into an academic career. Obviously, demonstrating a commitment to research is an important thing. Not only will you, potentially depending on the project, and we'll have a little bit to chat about this in a bit, but be thinking about whether you can gain any publications or presentations of your work, but you'll also be networking with other like-minded individuals, people who might be working in the same field that you're interested in, and you'll have the opportunity for mentoring with those individuals as well if you gain a particularly supportive supervisor or someone in the same field that you're interested in. The last thing is, maybe an obvious one, maybe not an obvious one, but the reason that we adhere to evidence-based practice and that we use it as a guiding principle is that it does help to make a difference. By advancing knowledge through research, it increases the base of knowledge that we have to inform our practice, and ultimately that helps our patients. And hopefully as well, you get a bit of enjoyment out of it too. So there are, obviously tick boxes and check boxes and point scoring systems. Not every research project you get involved with will necessarily result in you having the opportunity to present or publish your work. We hope that some of the things we will talk to you about today will help you identify projects that have a strong momentum and strong organization that make these things more likely. But these are just two of the many varied things that you can get out of research. So it's just thought it would be useful to touch on that.
Okay, so we're going to start with something abstract to kind of guide you through the process of when you've identified a problem and how to turn that into a research project. So just start off, this is Sarah. So she's a 5th year medical student, and her problem is that she doesn't know where to go on her medical elective. So how can she solve this problem? She needs some evidence for where is the best place for her to invest her time and money in to go on that elective. So she needs to create this problem and create a research question that she can then investigate. So just moving away from Sarah for a second, back into kind of a bit more of a medical context, we have just created some problems that you might see in hospitals on the wards that would need different amounts of research behind them to provide evidence to solve the problem. So something as small as the junior doctors can't keep the mess tidy, or something which might take a bigger research project, such as there's no guidelines as to what antibiotic to use for this specific infection. So how are we going to change these problems into research questions? Well, you might have heard of the SMART objectives. So it's a structure that is often applied to objectives and things to make sure that they are of good quality. And we kind of have discussed that actually they're quite good to apply to a research question itself. So when you're formulating your research question, is it specific? Is there a specific problem there? And what we mean by that is if you take something which is really, really broad, it's going to be really, really difficult to actually find the evidence that you need to back up, your hypothesis. And so something like, I want to cure breast cancer. I know that's a silly example, but it's such a big problem. You need to be quite specific in your research question. The second thing is it measurable? So is there an outcome that is measurable that will give you the evidence you need? Is it achievable is also really important. So with your personnel that you've got, with the resources you've got, quite often it's with the money that you've got if you need some resources, is it achievable to do this project with this research question? Is it relevant? And this can mean multiple things. So is it relevant to your context? Is it important? Is it going to create a new bit of evidence in the field? And there is a little bit about novelty here as well. So have you done a good enough kind of literature search or whatever to find out that that study doesn't already exist, or that research question hasn't already been answered? And the last one, which is timely, is just, it's kind of like the resources thing. Do you have enough time? How long will this take? Do you have an adequate timeline for you to actually get to the end of your project based on your research question?
Sorry, just to go back 1 second. The other thing about these problems that we've brought up here is hopefully we can demonstrate to you that research project can be something you can come up with yourself as a medical student. But it doesn't have to be giant. You don't have to be researching, grand overarching ideas that are going to get their way straight into the latest nice guidance. You can keep your research local. You can keep it specific to specific things that you see every day in your practice. So I think it's just a point about keeping your eyes open and seeing what opportunities there are out there. Another way, similar to the SMART objectives, that we can use to go from a problem that we've identified into an actionable research question is something you might have seen before as well. It's called the PICO tool, and it talks about the population that we're looking at for a research question, any interventions we're using and what we're comparing those interventions to, the outcomes that we're measuring, and the time that we're conducting a project over. You can see here what we've done is we've taken these hypothetical research problems, and we've just demonstrated how you can go from something a little bit more nebulous to something that is an answerable, actionable research question. So rather than, we don't know what antibiotics to use, we could design a trial or design a project asking the question whether ceftriaxone is better than amoxicillin, so an intervention and a comparator, for preventing complications, which would be our outcome in diabetic foot infection in elderly inpatients, and that would be the population we were studying. Similarly, you can see, even if we go down to something completely different, like do aggressive laminated signs as an intervention, reduce the measurable number of dirty dishes left behind by junior doctors in a tertiary centre mess. Again, you can apply this tool to any problem you can think of, and it will help you generate in your own practice, in your own projects, an answerable and actionable research question.
Yeah, and I think one of the other things we discussed as well is that even if you aren't necessarily ready to jump into creating your own project or creating your own research question, these are quite good things to look for when you are debating whether to get involved with another, with somebody else's project or, a team's project. Making sure that they have a specific defined population, a defined outcome, a defined intervention, is often a really good tool to make sure that they have the good foundation and the good basis that is going to make a good project. So yeah, when you're being asked maybe to be involved in things, this is something to fall back on and think, actually, is this a good research question for me to get involved with?
This is actually something that I just realized. I didn't realize this when we were making these slides, but during the COVID pandemic, I was working with the infectious disease team in my hospital, and one of the registrars asked me and another F1 to help him with some data collection for a project. And we all said, great, fantastic idea, we'd love to get involved, blah, blah, blah. But we asked why he was, what was his research question, what was he looking for? And he just said that he was looking, collecting the data to see what he would find. And needless to say, that project didn't really go anywhere. And it was quite a large waste of my time and the other F1's time. So it is useful and valuable to ask these questions and, to know, and hopefully we'll give you some other tips as well on what might be valuable for you.
Yeah.
Fine. So once we have got, we've gone through how we can go from a problem to a research question, but we need to talk a little bit more about where to find problems. We've already kind of mentioned that you can find them through your own personal experience, when you're on ward placements or clinical placements in other settings, or even, in the environment of the medical school, thinking about education and things like that. Your personal experience where you're seeing things go wrong or things that just aren't optimal can inform problems that can then be turned into research questions.
And every medical student will have identified some problems within their, within their university environment or something. That's just that, the nature of being at university. You all have your bugbears about the ways certain things are run. And maybe that's a problem that you could turn into an audit or turn into a research question. So just have a think about, what annoys you in your kind of day-to-day experiences.
Absolutely. If you want to get a little bit more formal, most guidelines and such as the NICE guidance, which we show here, or other guidance, national or international society guidance, often have research recommendations embedded within them because they've gone through the evidence and they've highlighted areas where there actually is not very much evidence at all. Obviously, sometimes this can be around drug therapies, which might require a large, randomized trial or meta-analysis to get an answer for, but it's still worth going in and looking at those things. And if you do ever get to the stage where you're applying for grants for extra resources for your projects, it's really, really powerful to be able to say, look, this is a research question that needs to be answered because the National Institute of Health and Care has said so, or the European Society of Cardiology has said so. So it's worth, especially if you find a field that you're interested in, thinking about that. Other places you can look, adverse events or interesting cases on your ward. For instance, if there's a time where this wouldn't happen nowadays, most of the people use electronic prescribing, but if a patient were given a drug that they were allergic to or intolerant of, or someone, as we'll kind of talk about later, had something improperly prescribed, how can you use those events to generate a problem that you can then have a look at in a more thorough way in a research terms. And then there's also ideas from your team or your consultant, whoever you're working with at the time, wherever they're working, whatever field, whatever ward, whatever clinical setting, they will have, like Philippa just said to you, they will have bugbears, they will have things that they know don't work quite right, and they're a great resource for looking for things, and they'll always be looking for people to help and that's where you can step in and offer your assistance.
I think it can seem all a little bit intimidating when we're talking about this, that you have to come up with this huge thing, and then obviously it's very, very difficult to get a research problem off the ground, a research question off the ground. But I think if we're completely honest, when we were medical students, a lot of the things we got involved in was us either asking people or the consultants being like, does anyone want to get involved in this sort of thing? So often it does come from more senior members of your team. But we just want to encourage you that if you do think of a way, think of a problem that you would like to create a research project out of, don't be disheartened. People will support you. So it doesn't matter which way you get into a project.
Yeah. And it will depend slightly on your stage of where you are in medical school as well. But if any of you have the opportunity to intercalate, then spend, a whole year, or, have a special study module or something like that, where you can dedicate a significant amount of time to research. That's when you can really get into the nitty-gritty of these things potentially.
Okay, so we're just going to go back to Sarah briefly. So she needs to create a research question based off this problem about where she's going to go on her elective, and we're going to use that PICO tool. So if you just have a little think yourselves about what her research question could be, but using the tool that we just showed you. So here's what we came up with. Obviously, there's lots of different versions depending on Sarah's personal preferences. So we've decided that this isn't a specific enough problem. Where does she want to go on her elective? Well, it really depends about what she wants to get out of her elective. Is she interested in learning more about, I don't know, adventure medicine? Is she interested in learning a specific subject? Is she interested in going surfing in her spare time? Is she interested in the enjoyment that people have had, or is it the chances to do research maybe? So what is Sarah wanting to get out of her elective? So we need to make the question a lot more specific rather than where does she want to go? So we just picked enjoyment. So we decided that Sarah wanted to know where what placements people have found the most enjoyable on their elective, which is, to be honest, still a little bit broad, but that's what we went with. The other thing is, if we think about the PICO or the Peacock tool, is the time. So if you think about it, maybe I'm using random examples here, by the way, rather not where we went on elective, but maybe someone went to Costa Rica 5 years ago and they had an amazing time on their elective. They really, really enjoyed it. But is that going to be so relevant to now? It might be that something's changed or somewhere else has got a really good program now. So we really need to make sure that it is time bound and that she's only asking about the last 2 years. And then the population is obvious. So the medical students, so we're most interested in people who are at the same level of training as her, rather than potentially other students at other universities that might go at a different level. And our intervention here is what medical elective placement is it that is the most enjoyable. So that's how we've created the research question based off this quite simple abstract problem that Sarah had. And hopefully this will show you that you can create research questions out of, quite abstract problems. Yeah.
So just to add something there as well, thinking about the time bounding can be quite important. And as medical students, you might be being involved in data collection for a project. And if you're looking through, say, patient notes or databases, things like that, you might want to know how far back do you need to go. That will often be determined by the exact question you're answering. For instance, one of my projects that I'm working on at the moment is looking at troponin, which is like a biomarker that's used in acute coronary syndrome. Many of you, I'm sure, will have heard about. There are lots of different assays for troponin, and there's first, second, third, fourth, and fifth generation assays, which all have varying, levels of accuracy and precision. If I'm doing a project on this and writing about them, how far back do I go? Do I go all the way back to the very first assays, which completely different when you try and compare them to the more modern ones? So if you are thinking about data collection, try and, in a way, it's to help you limit the amount of work you have to do and not go back too far. But think about when the most relevant data is.
And seniors will obviously help you with this. This isn't something you have to make decisions of on your own. Okay.
So one of the other things we talk about when we're doing a research project, and that can be whether you're setting up your own project or whether you're getting involved with someone who has a project that's going on, or that they have an idea, is we talk about objectives, hypotheses, and we talk about aims. Three fairly similar terms, but they do relate to different concepts. So I thought it'd be useful for us to go through those. When we talk about objectives, we typically talk about what outcomes we're looking to measure in our research. So if you're, that might take the form of a clinical variable. It might take the form, of a blood test. It might take the form of a validated questionnaire. It might take the form of a measurement on CT scan. But what you're looking at should have a defined outcome. Sometimes in research you can have several outcomes to look at different things, but you need to think about what it is that you're going to measure. When you're trying to think of a project, one of the best places to look is elsewhere in the literature. What have other people looking at the same thing you're looking at? What have they used for their outcomes? What questionnaires, what tools, what measurements? Talk to experts as well. Those can be local experts, clinicians, people people on your team, and look at guidelines. What's relevant to your practice, essentially, is what's important. If you can't measure it in real life, if you can't measure it in real life and you can only measure it in a research context, how useful is it going to be to us every day? So just think about what's the most useful thing, what's the most relevant to your practice. And obviously, supervisors and people on your team are there to help you and guide you with that. Related to this is the idea of a hypothesis. So a hypothesis is a testable statement of what you might expect to find, and it forms the basis of statistical hypothesis testing. Your current hypothesis would be based on the current evidence, whatever is out there in the literature, or it could be based on your clinical experience, what you see day to day. For instance, you might hypothesize that, going back to a previous example, junior doctors leave all their dirty dishes in the mess because the dishwasher's broken, or just because they're lazy. Those can be different hypotheses.
Or too busy on call.
Or too busy on call. Those can be different hypotheses that you can aim to test in different ways. The idea, like what statistical tests you might use to test a particular hypothesis, is a little bit beyond the scope of this talk. But if you are getting involved in research projects, then you will obviously have people to help, and experienced supervisors, hopefully, and team members. And there are always friendly statisticians, usually, that work closely with the medical school and researchers in that field. Aims then are essentially what you hope to achieve with your research. What is the value of your research, and how does your research go back to help solve that problem you first identified? So if our problem is that there isn't a guideline on a particular antibiotic, we don't know what to use in that situation, the value of our research would be to help guide practice in that sense. We can think then about how we can apply these to Sarah's particular project. She's talking about enjoyment, so she needs to think about an outcome to measure in that sense. And she would have to find some kind of tool, or develop some kind of tool to measure enjoyment as an outcome. But she wishes, her objective is to discover the best ranked elective destination for placement satisfaction, which is how she's decided to term it. The hypothesis would be, based on the conversations she's had, her experience, the things she's read, that students who did their elective placements in Melbourne in Australia had the highest satisfaction of all different elective placements by country. Her aims, therefore, are to ensure that she's satisfied with her own elective placement, but also to provide a resource for her peers to help them be satisfied with their placements. So you can see how she's going back to address that initial problem that she doesn't know, but also she's finding something more generalizable to help other people as well.
We randomly picked Melbourne, by the way. Other elective locations exist. Do you want to go?
Fine, yeah. Other things that Sarah will have to think about, and this is kind of where we'll leave Sarah to carry on with her journey as we get on with the rest of the talk, but what does she need to do next in terms of practically thinking about a study? And these, like we talked about the SMART objectives, these are things that are really important if you're stepping into a study to understand, what is the process, what is the timeline, because all of this needs to be thought about before you can start collecting data. Sarah needs to decide on a methodology for her study. She's already thought about the population, which will be, medical students who've just been on their elective in the last 2 years. She needs to decide on a design for her study. Is it going to be quantitative or qualitative? Is it going to be cross-sectional or longitudinal? And as we talked about, she needs to decide on her specific outcomes. She needs to plan this study. She needs to decide what tools she might need, how much time these things might take, all the different variables that she'll have to think of there. she needs to find someone potentially to supervise her with this. Does she have all the experience to do this herself? It's unlikely. It's obviously unlikely, you know, at our stage or at your guys' stage, that we all have all the information and all the tools and the skills we need. So she needs to find, you know, a friendly consultant, probably to help her supervise this project. She needs to think about ethics for the project. So research in the NHS that involves patients all has to go through research ethics committees, the process of which can take quite a long time, you know, weeks to months we're talking. Research involving medical students is slightly different in that it's not governed by the NHS in the same way, but she should still seek advice from her medical school and the university on what ethics is required. So all research should have an ethical consideration to it. She needs to think about what resources she has available, how she's going to do this particular questionnaire, how she's going to get it out to people, how she's going to gather that data, where she's going to store that data, how she's going to analyze that data as well. She needs to have a think about her statistical plan. And when we think about a statistical plan, depends on the type of study you're doing, but you might need to think about how many people you need to recruit to your study in order to gain sufficient statistical power. Again, sort of the stats behind research are a little bit beyond the scope of this talk, but just be aware that it's important not to just go out and cast a wide net and suck all the data in you can. You need to think specifically about what you want to do with the things you're finding and what statistical tests you might want to apply. Sarah also needs to think about who the audience is for her research. You know, if this is something she wants to take away and publish or present at a conference or something like that, who's she going to target with that? And, you know, what will her audience find the most useful and the most interesting? And how can she make sure that she captures that in her research?
Yeah, just to reiterate what Dan said at the beginning, that if you are kind of jumping on a project or potentially you're intercalating, so you're joining a team, I would really pay attention to whether how many of these things they already have through. As a medical student, you probably, you know, you can't have a full-time research job. So it's important to know things like ethics can take months. It can take a really long time. And when we intercalated, so we did research projects as part of our intercalation, and that's just the way our university did it. And lots of people were very wise in looking into the research teams before they agreed to do that intercalation project, just to see, have they got ethics through, have they not? And with my project, which was a clinical project, I actually, for about a month, I wasn't really doing very much at all, to be honest, because I didn't have ethics completed yet. So it is something to really think about, even if we're not expecting you to go out tomorrow and create a whole research study, but just think about these things. Are these things already planned and already in place? Because a good research project should have a lot of these things very explicitly stated, and the ethics should be, you know, being applied for and things. So things to think about.
Or you can dodge having to deal with all that and do what I did and work with flies in a lab, which works quite well.
So we thought, you know, talking about research, we could not put in the evidence, the evidence pyramid here. So hopefully you guys will have seen this before, but this is essentially all the different types of research you can do, and they rank it from the weakest evidence in terms of scientific evidence to the strongest evidence. So right down at the bottom, there's things like case reports, opinion papers. If we were to apply this to Sarah's context, this would be kind of just speaking to a couple of her friends in the year above and getting them to talk about their elective experiences. So it's quite weak evidence. In quite rare things and stuff, they are definitely very valid and very interesting, and is something actually you can really get involved with as a medical student. I know multiple of my friends were asked to kind of write up case reports with consultants when they were at medical school. So it's quite a good experience, and it gets you used to reading the literature around the case and things like that. So I'd recommend it, actually, even though it is right at the bottom of this pyramid. We won't go through this all, but obviously the gold standard evidence is things like randomized controlled trials. Obviously, in Sarah's context, that would be completely inappropriate. I'd guess that would involve taking random medical students and sending them blinded to random places around the world and seeing how much they enjoyed it, which obviously is not ethical, but also not feasible. So that's something to take into account as well. When you're picking your methodology or you're picking what kind of study it's going to be, then you do have to think about what is feasible and what's appropriate to your context. So I guess for Sarah, in her elective study, maybe a cross-sectional study would be most appropriate. So sampling people from the year above and with a questionnaire, seeing how much they enjoyed their elective, I guess would be the best way.
And so this is something you can think about when you're jumping on a project as well. You know, is this a long-term prospective study that you're joining? And you know, if you are thinking, you know, I'd like to get some kind of publication or presentation out of my research project in medical school, if it's going to be, you know, a 4-year prospective study where they're not going to unblind all the participants until you're already in F2, that might not be the best project for you to get on with and invest all your time in. Something that's short-term prospective, you know, in order of a couple of weeks or months, or even, you know, a retrospective, or like Philippa just mentioned, a cross-sectional study where you can get all the data collected at one time point. Those are the important things that you need to look at if you want to try and you know, optimize your output in terms of what's useful for you at your next stage of applications and training.
We better speed up a bit, actually.
Yeah, we should.
So we just wanted to touch on audit versus and quality improvement, partially because these are part of everyday life as a doctor, really. You will be involved in audit and quality improvement throughout your careers, even if you do not get involved in medical schools. But I do know a lot of medical schools, including, you know, Imperial, where I work, do actually introduce students being involved with audit and quality improvement quite early on, which I think is a great idea because it is part of our life. You have to do an audit in F1, you have to do an audit in F2, I think. So getting used to these terms is quite important. So just starting off with audit, this is quite a good definition from NHS England. So a clinical audit is a way to find out if healthcare is being provided in line with a standard and lets care providers and patients know where their service is doing well and where there could be improvements. So that the key thing is that with an audit, you're comparing practice or what is already happening to a standard. And I know NHS England there has talked about obviously care providing, but you can do audits within education itself. So as long as there is a standard you're comparing it to. And by a standard, we mean either a national guideline or it can be a local guideline. So it doesn't have to be you know, it doesn't have to be a national thing, but it does need to be a formal standard that you're comparing your current practice to. I thought this quote was quite good at explaining the difference between research and kind of audit work. So a research is concerned with discovering the right thing to do, so finding further evidence, and the audit is to do with ensuring that it is done in line with what the evidence says, essentially. There's lots of different ways of doing an audit, but pretty much this is the kind of standard cycle. You'll see lots of different versions of this kind of flow diagram online, but they all basically say the same thing. So identifying an issue, define what your standard is, which is really important to do at the beginning, collect the data, and then compare the data with the standard. And whenever you're doing an audit, you are doing it to try and make sure that you are hitting the standard. And if you are, that's great. But if not, you're looking for ways to improve as well. So just to say, I'm just going to give you an example here, so it's a bit less abstract. So in one of the audits I did, very, very simple, was looking at the number of people who were prescribed oxygen when coming into hospital. So there's a national guideline that says that every patient should be prescribed oxygen when they come into hospital. So me and a friend set up this audit. We essentially looked at all the medical patients in the hospital that we were working at the time and looked to see if they all had oxygen correctly prescribed on their prescription charts. We found out they did not. And then we compared that obviously to the figure that is meant to be 100% and said, obviously, we're not meeting that standard. So what changes can we make? And then we went on to make lots of different changes to try and increase that level of patients being prescribed oxygen on admission. So it's just a small example for you. So on the other side of things, what's quality improvement? I think this really confuses quite a lot of people about the differences between audit and quality improvement. And the reason it confuses people is because audit is a type of quality improvement. And people talk about quality improvement projects being kind of completely different to audit, but in reality, audit falls under that same umbrella. However, a quality improvement project in itself does not require that defined standard. So it does give you a little bit more freedom. Normally, unless you're doing anything huge, and obviously I would speak to seniors about this, but you don't need the ethical approval because you're just improving the patient care or improving the standard that's already in place. So there's lots of different cycles of how to do a quality improvement, but the one that most people use is the PDSA cycles, so the plan, do, study, act cycles. The reason why people use this is to make sure that you are spending as much time planning your improvements and analysing your results as you do actually doing and acting on your results and doing the intervention. Here are some things which I think are quite important before jumping into a quality improvement project, particularly as a medical student, actually. So the first thing is, what will you do to ensure that you understand the problem you're trying to solve? So as a medical student, there's probably lots of things you notice on the ward. It might be that the ward round notes are never in the right place when the ward round starts. So the team always wastes 10 minutes trying to find the notes. I'm just hypothetically making that up on the spot. So, but there might be things that you don't quite understand about that problem as to why it's happening. So it might be that actually at 8 o'clock in the morning, before any of the medics are in, the ward clerk has to do something with the notes, and that's why they're in a different place. So it's really important, even if you've identified a problem, that actually you ensure that you completely understand that problem before you try and put anything in place to solve it. And that might be market research. So what I mean by that is going and speaking to all the members of the team that ever use the notes and making sure that there's nothing else. That's the main way of making sure you understand the problem, but it's something to sit down and think about. The second thing is, how will you involve your colleagues and patients in your project, and how will you gain support from senior members of staff? That's really important as well. So going back to this example with the ward round notes, it's never going to work unless you get the consultants on board, the ward clerk on board, the senior kind of physiotherapists who also use the notes on board. It's never going to work. So how are you going to make sure that those people are going to get involved in your project? And often that's just sitting down and chatting to them and having an open conversation about where they think the problems are and what you can do as a team to help it. And the last bit is what steps will you take right at the start to make sure improvements are sustained? There's absolutely no point doing quality improvement projects and then as soon as you leave the ward, things go back to how they were. You want to make sure that those improvements that you have made are sustained.
These are similar to how you would, the things that you need to think about for a research project, but any audit or QI project, you'll need to find someone to support you with that. Plan what your outcomes will be, roughly how long it will take to collect your data, and to do one of those PDSA cycles. How many cycles would you like to do? It's always a good idea to recruit your peers to help with data collection, and say 3 or 4 of you plan audits or improvement projects, 3 or 4 of you help each other with the data collection. That's 3 or 4 different projects that you've been involved in and got experience from. One particular point about quality improvement projects is most trusts have a quality improvement team. You can register your project with them and they can support you.
They also normally have like examples that the hospital, if you're working in a specific trust, particular audits and quality improvement projects that they actually have on a list as to ones they want to do next. So even if you don't have any ideas for what could be improved on a local level, then you can actually go to the audit and QI team and they will either get you involved in a project or actually say, look, there's this problem, do you have any ideas? And they'll always get you involved. So that's a really good tip if you feel like, gosh, I don't have any ideas myself.
Yeah, that's definitely get involved. They're always very, very helpful as well.
Yeah.
This is just a couple of examples. You can see here that not every QI project or audit needs to be super clinical. You can think about your own education as medical students as well. You know, you're the guys receiving the education, you're the people it matters most to. Also think about, you know, the logistics of the working day, similar to what Philippa was talking about with patient notes. So there are a whole variety of projects from very small to much bigger that you can get involved in. I initially made this sort of cycle with regard to research, but we realized, you know, it's just as applicable to audit and quality improvement. These are the steps that you will go through for any project. So we've already talked about formulating that research problem, that research question, planning in terms of methodology, resources, etc., etc. Then there's the actual carrying out of the research or the project, gathering your data, implementing your changes, whatever that may be. You then go on to do analysis, statistical or thematic analysis, whatever you're doing. You write about the project and then you share the project. Sharing the project informs practice, and then our practice informs what problems we want to tackle next. You can get involved basically anywhere in this cycle as a medical student, especially. And you can see that you can get outcome from anything by using this cycle. So, you know, just because an audit or a QI project doesn't count as research doesn't mean that you can't present it or get something from it and get those just the same skills of analysis, in-depth knowledge of that area, leadership skills, mentoring, etc., etc. You know, you can present audit and QI at a conference just in the same way that you would present research. So the boundaries are a little bit blurred.
There's a lot of transferable skills that you'll learn, and they're quite easy at getting into, I think, probably easier than like a research project. So where to start? Again, we've touched on this a little bit already, but talk to your supervisors. If you're very keen, they will react to that. They'll respond to that. You know, doctors love it when medical students are keen. And if you go up to somebody, potentially a supervisor in a subject that you're interested in, and say, look, actually, I'm only a fourth year medical student, but I'm actually really interested in gastro. Do you have any projects or audits that I could get involved with? And they will absolutely love that. So do speak to your supervisors, your consultants, even juniors on the team about, you know, who to ask. Consultants or academics in your specialty of interest. So I think you approached some consultants.
When I was in my fifth year of medical school, I was quite interested in psychiatry at the time. So I emailed one of the psychiatry consultants who was working in research in an area that I was interested in, went and met him, one of his postdocs, and yeah, we got involved in a project which got published last month, which was very exciting. Just so, yeah, I mean, it can be out of the blue. And just like Philippa said, you know, if you're enthusiastic and if you're, you know, raring to go, they will react in exactly the same way and reward you for that.
So the other people involved, so not just consultants, there's also whole teams of kind of research nurses. The audit and QI team we've spoken about are really good people to contact. Look out for bulletins, emails from the universities or from the trusts. Quite often they'll be looking for people to get involved with things, or even things like data collection. So yeah, have a look out for those bulletins, actually read those bulletins. I know it's tempting to junk them, but actually read through them. And then medical school contacts as well. So sometimes there might not be somebody that's working in your trust that you're working in at that time, but there might be someone affiliated with your medical school that has a particular interest in something, and feel free to email them if their email address is online. Just make sure you're very polite, explain who you are and what you're looking to get out of something, and most of the time people are really happy to help you out, particularly when you're really junior and you're learning. So yeah, just give it a go is what I would recommend. Choosing the right topic. So the number one thing is, are you interested in the topic? I cannot press this enough. If you're not interested in it, don't spend months data collecting. Don't spend months having to read the literature. If you're not interested in it, it's just going to be terrible. And as a medical student, you need to have fun. You need to be able to keep up on top of your studies. You need to be able to do your extracurricular stuff. You need to be able to see your friends, etc. So don't be spending hours doing something which you're not interested in. That's the number one thing. And if you only remember one thing from this talk, it's that. Please only enter into projects that you actually have a genuine interest in. Yeah,
just as a note, you know, it can also be an interesting gaining the skills from the project. So it doesn't have to be that you've decided that you're definitely going to be a pediatric orthopedic surgeon, and therefore you're going to work with that team on a particular project. You can be interested in gaining the skills from that as well. Other things to think about, we've already spoken, does the project have aims and a timeline and ethical approval? If it's going to take months and months and of you sitting in your hands, is that the best use of your time? Does the study have achievable outcomes? Is it, has it done all those things that we've already talked about? Does it have specific aims? Is objectives smart? But also think about how much time you can commit. Are your desired outcomes achievable in that amount of time?
And be very honest about that as well. I would definitely, particularly if you're kind of final year, got a lot of things on your plate, be honest. If you get involved in an audit, say to the audit lead, listen, I can give 1 hour a week to this, and that's how much I can give. They need to be on the same page as you. So be honest about that.
Absolutely. Yeah, definitely. But also think about what you want to get out of the project. So we've already spoken about, you can gain skills. Do you want to learn a bit of coding in terms of data analysis? Do you want to learn more about statistics? Do you want to get experience consenting patients for studies that you can take forward? Or do you want to get, experience with the ethical approval process? Or, are you really keen to bolster your application with a couple of presentations, something like that? Think about that, and think about the things we've spoken about today, and which of those points are relevant to you, and which project therefore is the best fit for what you want.
And kind of linked to that as well, look at what you've already got on your plate. Might be nothing. I mean, definitely early on in medical school, I had no experience at all, so don't worry about that. But if you are a little bit more experienced and you've already done an audit, or you've already done a quality improvement project, then think, actually, maybe I should do something else, just to get skills in a different area. So have a think about what you've already done.
Yeah, thinking about skills, for a particular project, you don't have to necessarily have the skills yourself, but what you do need is adequate supervision from someone experienced in that area. And, you need to know whether or not you can learn those skills. So knowledge at the time isn't necessarily a barrier if you're willing to put in the work.
Other things to consider. So is it going to be clinical research? Is it lab-based? Is it educational? So just have a little think about what interests you and what you'd be wanting to get involved with. Is it audit and QI, or is it more of research? And again, we've kind of touched on the fact that audit and QI can in some ways be kind of easier to get into. You don't necessarily need the ethics, can be a lot more local, but research also is just different. So there's lots of different skills you'll get from research. So which one are you interested in going into? Is it a local versus a national project? One small thing I will say about this is that I would potentially, obviously it's up to you, but potentially try to avoid doing too many big national things, just because I think you can make better change if you're doing local things. And I think as a medical student, you get more out of doing local things because you do get to lead more, you get to use your skills more, and if I'm really honest, you probably get more out of it in terms of kind of like points and stuff for it. So I'd recommend thinking about that. The national projects are really cool, and obviously we do need people to do them, but just think about maybe having a good mix. And then, does it have flexible working hours? We've kind of touched on time already. Just at this point, I just want to mention to you what some of our kind of friends did at medical school. I thought it'd be quite interesting. So I've kind of asked around a little bit what kind of research they got involved with. So a couple of friends, like I mentioned, said they did case reports, and most of the time that's them asking consultants, is there anything you've been wanting to write up but don't have time to do? And then they kind of respond to that. Quite a few people did some audits, and that I did a couple of audits in medical school, and that was usually local audits, so looking at your local environment, again asking consultants for ideas. Some people did do data collection for national audits as well. Someone did a QI relating to kind of medical education and their like direct environment, so that's quite good. And then some people got involved in kind of consenting and recruiting. I think it's a little bit more difficult as a medical student, but it's something you can look into, kind of consenting and recruiting for trials.
It depends very much on the nature of the trial. So if it's a trial with a drug, like a drug trial, you have to be a physician to do that. But for things that are like observational trials, or where you're just asking for permission to collect data, usually medical students can.
Yeah. And then one person said they got involved in writing a review, so they, didn't do any research themselves, but kind of sat down and wrote a scoping review. So looked at the literature and formulated a review from that. So there's some ideas.
Just touch on that briefly. If we are thinking about points and outcomes and things, most places will. It's difficult to get involved in a systematic review, but if you can, you have appropriate supervision. Systematic reviews are usually classed up there with sort of like primary research for points purposes.
Not that that's the
Not that that's
goal.
but
yeah.
There's a couple of links here. So if you wanted to think more about clinical research, the NIHR's Good Clinical Practice is the framework that kind of guides research, and they have e-learning and things and accreditations and whatnot. The Academy of Medical Sciences Inspire initiative is sort of a mentoring scheme, and they have grants available. And so that's their link there, which is quite a lot of useful resources. And similar to sort of the NMRA that we're helping with today, there's an old inactive website for the National Student Association of Medical Research, which has a few sort of interesting resources on. I've not seen it updated, but again, it's just a decent bank of things that we can touch on. That is everything from us today.
Yeah, we've talked for a lot longer than I expected us to. So
we've
only got a couple of minutes, but we're happy to hang around in case anybody has any questions.
That's a really good question, actually, I think, about writing a draft on your own. What I would recommend is, if it's something like a case report or even a small project, whatever project you're doing, I would recommend you sort of draft an outline first. I wouldn't put hours and hours into putting 3,000 words down on paper, but I would come up with headings and bullet points and then bring that to somebody, and then they will say, actually, you should insert a section on XYZ here, or I don't think that's the most relevant section or the most relevant paragraph. So I think it's definitely useful to have a structure with you and then bring it to somebody, but I wouldn't say write a whole draft. I would do that outline structure first and then take it from there with some advice. But very, very good question, actually.
Okay, if no one else has any questions, then we will end the call here. Thank you so much to everyone for attending today.
Thanks, everyone. Thank you, Ruth.
Guys.
Bye.